The Breast Cancer Awareness Month of October is going on, and it is there to shine a spotlight on one of the most prevalent health issues concerning the woman of today globally. Everywhere we see people wearing pink ribbons and women wearing all shades of pink to support and honor the survivors, to remember those who have lost their lives to the disease, and to create awareness amongst the rest so that they can have an early detection with the help of mammograms. Because the earlier it is detected, the more treatment choices are available and more is the survival rate, less is the mortality rate. Amongst all the cases of cancer that occur annually, 12.5% new cases are just of the invasive type of breast cancer. It is the second most commonest kind of cancer seen in the women folk. Usually, middle-aged women are affected between the age of 50 to 74 years, but from the last 2 decades, it is being noticed that the incidence is increasing even amongst women who are less than 50 years of age. It is more prevalent in white women than in the Asian, Hispanic and black women, but the mortality rate is much higher in the black women. In the white woman, it usually remains as a localized lesion. So, how do you detect it? How do you notice the signs and symptoms so that you can contact the doctor right away? Cancers, we know, are the uncontrolled growth of abnormal mutated cells, which form lumps and masses because of their rapid growing, and then to consume more nutrition, more energy, they start invading the tissue surrounding them by spreading out tentacles and branches, and ultimately, if it is still undetected and untreated, they move away to other parts of the body and set up secondaries of the same kind of cancer until they consume the whole body and there is no chance of survival. So, breast cancer also first forms a lump or a mass which can be seen. There can be changes in the shape, symmetry, size of the breasts. The shape can change constantly due to growth of the tumor tissue. The skin, it can be red, it can be hot, it may be painful, there may be puckering, there may be folds, there may be wrinkles, or there may be a typical orange peel appearance, the peau d'orange. You notice any of these symptoms? Please contact your doctor right away so that you can have an early mammogram. Mammograms, clinical breast examinations and MRIs can help detect the cancers very early, and every woman from the age of 40 years till the age of 70 years should have a mammogram annually. And if you fall in the high risk category, then you should be screened from 30 years onwards. For those people in which there is a family history, that means either a mother, a daughter, or a sister has had breast cancer or ovarian cancer, they will need screening 5 to 8 years earlier than when their first blood relatives had it, so that they can be early detection. Now, who are the people who are at risk? We can divide them into two. Some of the risk factors, they are not changeable. You have no control over them, and some are the changeable ones. So the unchangeable ones, they are increasing age. There is a family history. You cannot change it. There are gene mutations which run in families, especially the BRCA1 and BRCA2 gene are associated with increased incidence. They are the BRCA1, BRCA2. Then, if you have dense breasts, you are more at risk because it remains undetected for quite a long time. Then, those who are having menstrual periods very early in life, the onset of menstruation before the age of 12 years, or who have got a late menopause, that is after the age of 55 years, they are all at risk and you cannot change anything about it. Whereas the changeable risk factors, they are being overweight, being obese even after menopause. Then smoking, alcohol consumption, extra exposure to radiation, even lack of sleep or changing sleep patterns can disturb the hormonal balance and make you prone to it. Then those women who are taking oral contraceptives, those who are having hormone replacement therapies after menopause, if they take this HRTs for more than 5 years, which contain both estrogen and progesterone, they've got an increased risk. Then if you have had ovarian cancer or you have been exposed to drugs such as the DES, diethylstilbestrol, which is usually given to women for miscarriages, they also get prone to increased incidence of breast cancer. So, what can you do about it? Please get yourself screened on time. Be aware, spread the knowledge, and get the screenings. If you can do all these things, you might be able to save yourself and save more lives. Thank you, and inshallah we'll meet again with another topic. Assalamu alaikum. I'm Dr. Mariam Ati.